been through quite a lot in this city, this region, this country, and this world over the past 8 weeks, and going back all the way till the end of December. A lot of the people that get mentioned are those that work in the medical industry, in our hospitals, our doctors and nurses, our frontline services, the people that provide us with essential services, from the food we eat to the gasoline we put in our vehicles. But rarely do we get a special moment to celebrate public safety officials, and namely public servants. Pittsburgh's blessed, and I've said this before. We have a public safety director who's worked at the highest levels within the FBI on counterterrorism and understanding all the different ways that we have to work together in order to be able to solve problems, especially man-made disasters and natural disasters. We have a chief operations officer who served as the chief of staff to the Secretary of Homeland Security, and sat at the table with generals from Africa and helped to work on national defense issues for our country. And all the way through the ranks of Pittsburgh city officials, we have those that have served in high capacity. I would put our staff up against any staff of any government at any level in this country. But as we celebrate Employee of the Month this month, and actually last month we're looking at today, I want to take the time to recognize somebody who's been at the very, very forefront in COVID-19. Somebody who had the experience back over a decade ago in battling H1N1. Somebody who was responsible back then to create a pandemic guidebook for our public safety department, for each of our bureaus, to be able to know what to do when you're in a situation where there are no guidebooks to help you. And somebody who, through this process, while dealing with the pandemic, has rewritten that guidebook and given us new direction with the use of technology and in ways that other cities aren't even utilizing yet. We're working now hand in hand with our medics and our hospitals in telemedicine. We're working directly with our fire bureau in being able to concentrate on the life-saving issues that they face. Our police bureau has been able to adapt and to be able to become not just those that are protecting and keeping the peace, but those that are serving the community at large. And all of that is due to the work of Chief Pinchot. Chief, if you could come up 6 feet from me. I've got a couple people on the screen that wanted to share this with you. Is there a way that we can bring them into the conversation? Well, if not, they're watching right now. Your daughter and your wife, who kept this secret from you.
Yes, they did.
In order to be able to do this. Whereas Mark E. Pinchot began his career with the Department of Public Safety's Bureau of Emergency Medical Services on July 30th, 1990. And whereas Mr. Pinchot would rise through the ranks, serving as crew chief, patient care coordinator, and division chief before being promoted to the role of assistant chief in 2020. And whereas Mr. Pinchot has helped to mold generations of new paramedics through his work as an instructor at the Center for Emergency Medicine. And whereas Mr. Pinchot's training work has directly impacted the care our residents receive daily. In his role as director of the Bureau of Training Division since 2014, he has written and designed many of the complex present-day training courses for the Bureau. And whereas Mr. Pinchot has been a leader in our city during one of our nation's most challenging times. When the scope of COVID-19 pandemic became clear, he coordinated the planning and execution of our response. And whereas Mr. Pinchot has the support of a loving family and wife, Kristen, and daughters, Grace and Chloe. They're over here. Yep, he's waving to you guys. Whereas Mr. Pinchot has worked day and night not only to prepare our public response, but his leadership and experience in these unprecedented times have been second to none, and he has fully lived up to the czar nickname given by the Director of Public Safety. Now, therefore, be it resolved that I, William Peduto, Mayor of Pittsburgh, do thank Mark E. Pinchuk for his decades of dedication and service to Pittsburgh and its people during these most difficult times, awarding him the Mayor Sophie Masloff Employee of the Month Award for April 2020. Furthermore, declaring Wednesday, May 6, 2020 is Mark E. Pinchuk Day here in our most livable city of Pittsburgh. Congratulations, Chief. We don't have a plaque to give you because plaques apparently aren't essential businesses. So once they reopen on the north side, we'll have that printed and made for you. Before I turn it over to you, I want to turn it over to the director and to Chief Romano as well. These are two men who have spoken your praise since your promotion and have always stated the reliance that they have, not only in the work that you do, but the advice that you give them. We're at a good place right now. We are on the backside of what looks to have been a plateau at the end of April. And as we see these numbers continue to go down, it's a time of caution for us. It's not a flag that says we're ready to reopen everything, but it is an opportunity to start to see some things begin to reopen. And as that happens, this city, this region will be counting on your advice, working with medical experts, working with technology in order to be determined how our public health will always be at the forefront of the decisions that we make. Director?
Thank you, Mayor. Chief Pinchuk, congratulations.
Thank you.
The planning actually started for this event, I believe the third or fourth week in January, when the Chief of Staff and the Mayor came to me, and they had some concerns about what was going on in China. And they said that they were somewhat concerned about it, and so was I. And we began some initial planning. At that time, I went to Chief Romano from EMS, and I says, who's the best person you have regarding planning for a potential pandemic, which we hope would never come to Pittsburgh or the United States. And without hesitation, Chief Romano says, Assistant Chief Pinchuk, who had helped plan for the 2009 H1N1, and then 2014 for the Ebola. And he had all the plans ready to go. We had to do some revisions with Chief Pinchuk's help, and emergency management, and planners from fire and police, as well as the other departments within the city. As we came to February, the planning intensified, so did the concern. We started to prepare the first responders by providing them additional PPE, advanced training, and started to make sure our equipment and supplies was up to par. Everything from ordering additional supplies to making sure the equipment was well maintained and ready to go. Then came March, the concerns even grew further. At that point, as was described to me, the train was on the tracks. It was just a matter of when it was going to come to Pittsburgh. We started to work a scheduling plan to make sure that we could support the essential services, not only through public safety, but through this, all the departments within the city. We work within the city's different departments, and the concern even grew more and more as we approached the large event of St. Patrick's Day. A decision had to be made as to whether or not large events was going to occur and what the safety concerns were. Coordinating with our external partners, Allegheny County Health and PEMA, Emergency Management, a decision was made in the best interest of the public to cancel those events. We continued day to day with having daily conference calls with internally, externally, and as the mayor stated, hopefully we're on the back end of this, and hopefully there won't be a resurgence. But if there is, rest assured that Chief Pinchuk and Public Safety will be ready to go. With that being said, I want to take a moment, thank all the first responders, police, fire, EMS, and of course our healthcare community. A special thanks to the nurses at the beginning of Nurse Appreciation Week. It's a team effort. It's a unified response throughout the city, throughout the county, and throughout Region 13. And I'd also like to thank the public for their support and their understanding during these times that the unknown times that we faced. So with that, I will turn it over to Chief Romano of P for the Emergency Medical Services. Chief.
Thank you, Director. Congratulations, Mark. I was thinking this would happen after we had come out of the crisis, that I was going to recommend that this happen for you, but the mayor saw fit that this happened a lot sooner due to your hard work and everything you've been doing for this city. Just to recap, EMS is working at full capacity. We're responding to all details as we normally do during the pandemic, along with the additional calls that they generate. We run 2 additional units under Mark's recommendation to help support the on-duty units. At this time, all our workers are safe. There's been no problems. We keep check on them daily under Mark's guidance. He's been available for any questions for them with their before they go home to their family, or if they have any questions before they come into work. A great job by our EMS employees out there during this time also. But because of Mark's guidance and having that plan available, he said, I'll dust it off and have it ready. And I was able to tell the director that, and we were able to go. And under his guidance, I think we've done great things. We've protected our employees, most of the employees in public safety, and all the citizens of Pittsburgh to the best of our ability because of Mark. And without ado, Assistant Chief Mark Pinchot.
Thank you, Mayor, Chiefs, Director. So just give you a little overview where our planning came from. Our original planning started actually back in 2007 for H5N1 influenza. We employed that plan in 2009 for H1N1 and did periodic updates over the years for evolving threats such as Ebola and measles even. So the basis of our plan, it kind of has 3 main areas. The first one is force protection, be able to keep our workforce safe. We obviously expanded that to the rest of public safety and other key departments. If we can operate safely in the environment, we can go out and do what we need to do from a public safety perspective. The second part is surge staffing to maintain the same quality of care as we do outside the pandemic period. So we had a 3-level plan built, and because of the early decisions to enforce social distancing and lock down our communities, we're still at level 1 of 3 of that. Level 1, we have 2 specialist units. We call them ECHO units, or infection control teams, and they basically support the rest of the operation. They do training in the field. They address out of maximum levels of PPE and do high-risk patient procedures such as intubations or other airway skills. And they do disinfection and decontamination of units in the field. In addition, those units are doing some specialty things under expanded scope of practice. They go out on behalf of the Allegheny County Health Department and collect COVID-19 test samples from people in their home, and it helps with containment and mitigation. These people aren't coming out in the community to get tested. We also assist Department of Human Services in moving homeless or vulnerable patients to safe havens. So once again, they're not out on the street. So our protection plan has multiple levels, making sure our personnel have appropriate vaccinations for seasonal influenza, making sure we're screening our employees when they come to work, making sure we're screening calls at multiple levels, screening them at the 911 center, screening on scenes, using telemedicine to determine who needs to go to the hospital versus who can go home. And then the third part of the plan is really kind of maintaining the operation and altered standards of care. So we want to maintain the same level of care that we're doing for everybody. We want to make sure everyone gets the proper care based on their medical complaint. So one part of that is kind of just the telemedicine part to determine who's safe to stay home and who isn't. And the other part of that is just be able to operate in really high levels of protection and doing stuff really we've never done before. Doing resuscitations of really sick patients in full biohazard suits with respirators on and that kind of stuff. And that has gone very well for us. So it's an evolving process. We had a base plan. Some of it we kind of threw together really quickly during that second week of March when we had our first cases in Allegheny County. And I really give a lot of credit to our personnel out in the field. So much was happening at once. We were throwing out just very general orders, kind of skeletons of improvised plans, and the people in the field took that and built a new doctrine for us that's worked really well. So we update this by day. We're lucky to have the very strong relationship we have with everyone else within the Department of Public Safety, that we're interoperable on this planning, and we keep all of our people safe. We have very good relationships with the Allegheny County Health Department, Department of Human Services, and the hospital systems in the city. And we kind of work as one integrated team. And things change day by day with us. Every day we're reevaluating the information, the data, the epidemiology, and we flex things on the fly. So we feel very good what happened so far, but we're 2 months into maybe a 12 or even longer month problem. So we got to maintain our vigilance. We got to ask the community, even if we start moving into yellow at some point this month, that they be very careful with all the social distancing guidelines. And we still have a long way to go with this. So, Mr. Mayor, thank you.
Thank you. Chief, you got to take your proclamation.
Where's that?
The director?
Oh, thank you.
Okay. I think that's it below, isn't it? No?
I took it. Took it.
Well, first to the family, thank you for sharing them with the city of Pittsburgh. Like I said, we're very blessed with the people that we have working on our teams, and especially on the COVID-19 team. It goes across departments. There's a great cooperation between directors and chief and staff in order to be able to do what is in the best interests of the people of Pittsburgh. Chief Pinchot is that point of the spear. I don't want to try to say that one city employee is above all the rest when dealing with a global pandemic. But if there were a face to be able to put on the city worker, the person that has taken this on at their own risk, and I'm sure you realize that too, it is Chief Pinchot. And so thank you to his wife, to his daughters, for sharing him with the people of Pittsburgh and allowing him to use his talent to keep us safe. To the rest of the city employees, to everyone that is doing your job, whether doing it from home or doing it out on that street and dealing directly one-on-one with people who are infected. On behalf of the people of Pittsburgh, thank you. We thought that it was important to take a moment at this time as we can look back over the course of the past 10 days to 14 days of seeing that plateau of the numbers of hospitalizations and numbers of fatalities, and starting to watch as it starts to slow down, and understand there's a moment where we can thank those that are still out in the street and still working from home in order to keep the people of Pittsburgh safe. No matter what department you work in, no matter what it is that is your job as a Pittsburgh city employee, the first order of business is that we keep our people safe. We must have priorities. We must have a true north. And our true north is the people in the city of Pittsburgh will be kept safe. And for the work that you've been doing in order to maintain that, and the sacrifices you've been making in order to make sure that that continues, thank you.